name is Cheryl Bushnell. I am a vascular neurologist at Wake Forest University School of Medicine and a professor of neurology. And it's my great pleasure to provide this information about our primary prevention of stroke guidelines. Why did we decide now is the time to update the prevention of stroke guidelines? It's actually been 10 years since the previous prevention of stroke guideline, and many advances have been made in prevention since then. So we feel that our recommendations would also need to be updated. The other context is that stroke is the second leading cause of death globally. So this is a major public health problem. And we think that really prevention is of the utmost importance because not only do we want to reduce the risk of a disabling stroke or any kind of stroke, we really want to preserve brain health. And we think that stroke prevention accomplishes both of these. At a very high level, this guideline focuses on relatively simple approaches to screening and prevention using the framework of Life's Essential 8, which is promoted by the American Heart Association. This is a framework for awareness of risks and behaviors that can impact cardiovascular health and brain health. In this guideline, we provide recommendations based on advances that have occurred with regard to the most established risk factors, such as diabetes, cholesterol lowering, and hypertension, as well as lifestyle changes, which includes physical activity, diet, weight loss, and sleep. The other context for this primary prevention of stroke update is that the first and only prevention of stroke in women guideline was published about 10 years ago. I was privileged to be the chair of that writing group. So this guideline actually includes the perspective of women's cardiovascular and brain health in addition to primary prevention as a whole. So the field of stroke risk during pregnancy and following pregnancy complications, for example, has just exploded in the last 10 years. So there is a wealth of evidence for why we should promote awareness and screen women for a history of pregnancy complications. In addition, some newer conditions that are associated with stroke include endometriosis.